Have you ever been woken up by, well, what sounds like a freight train, only to realize it's coming from the person sleeping right next to you?
Uh-huh.
Or maybe you're the one, keeping everyone awake,
Mm-hmm.
and your partner's maybe invested in some serious earplugs.
It happens a lot.
Yeah. Snoring isn't just like a nightly annoyance. For millions, it's a really critical red flag for something much more serious. Obstructive sleep apnea, or OSA.
Right.
The toll it takes is just immense, not just on sleep quality, but on your overall health, your energy, even relationships. And for a long time, the traditional solutions have felt, well, frankly, like a bit of a catch-22.
That's very true. I mean, imagine facing sleep every night, choosing between wearing this mask, like an astronaut's helmet almost, tethered to a machine,
Yeah.
disrupting intimacy, spontaneity, or the alternative, a painful surgery that might change your voice, maybe leave you struggling to swallow,
Hmm.
and still might not even guarantee a cure for the underlying sleep apnea. That's been the frustrating reality for so many people.
Well, tonight, we're diving into something that offers a really different path.
Sure.
We're going to unpack a pretty groundbreaking non-surgical laser treatment called NightLase.
Hmm.
We've pulled together the source materials you shared to really get under the hood of this innovation.
Yeah, and our mission today is to understand exactly how NightLase works its magic, like
Mhm.
right down to the cellular level, how it transforms tissues. We'll
Okay.
explore the benefits it promises, how it actually stacks up against those existing options, and crucially, what the science is really saying right now.
Right.
The goal is for you, the listener, to walk away not just informed, but, genuinely understanding this potentially game-changing approach.
Okay, let's start by painting a clear picture of the problem itself. Snoring, at its simplest, is just that noisy breathing sound, right?
Right. It happens when the soft tissues in your throat, mostly the soft palate at the back of your mouth, vibrate as air squeezes past.
But then there's OSA, obstructive sleep apnea, which
Yeah.
takes it a significant step further, doesn't it?
It absolutely does. While snoring is often just about the vibration, OSA is more severe. It's where your airway actually collapses or gets blocked repeatedly during sleep.
Stopping breathing altogether sometimes.
Yes, actually stopping your breathing. And these repeated disruptions, they don't just mess up your sleep, they trigger a whole cascade of health issues.
Like what specifically?
Well, chronic fatigue is a big one. Low energy, persistent mood swings, those awful morning headaches,
Mhm.
even things like depression, and just that deep exhaustion no matter how many hours you think you slept.
And as you touched on just now, the traditional fixes for this have some pretty major drawbacks. CPAP machines, for example. They
Yeah.
work, right? They keep the airway open.
They do. They're undeniably effective at that specific job. But the day-to-day, or rather night-to-night reality of using them, that can be a huge hurdle for people.
Yeah, the compliance issue.
Exactly. The adherence rates for CPAP are, well, notoriously low. A lot of patients just find the nightly commitment, the mask discomfort, or that feeling of being confined, it's just too disruptive.
Okay, so that's CPAP. What about surgery?
Well, surgery is, by definition, invasive. It often means significant discomfort, a pretty lengthy and sometimes painful recovery.
Right.
And you have the potential for long-term side effects. Things like a permanently changed voice, difficulty swallowing, or even this persistent feeling like something's stuck in your throat.
Hmm.
And here's a really critical point. Some surgeries might quiet the snoring noise, but they don't always effectively treat the underlying, more dangerous sleep apnea itself.
So when you weigh up those daily hassles and the surgical risks, you really start to see why people would be looking for something else.
Absolutely.
That's exactly where NightLase comes in, developed precisely to be an innovative, truly non-invasive, and much more patient-friendly alternative.
Precisely. NightLase is a patented, non-invasive laser treatment. It's specifically designed to, well, revolutionize sleep quality by significantly cutting down snoring loudness and easing the effects of OSA.
The name itself is pretty clever, NightLase.
Yeah, night and laser, it reflects its purpose perfectly.
And from the patient's point of view, this sounds immediately appealing. No cutting, no injections, no anesthesia needed.
That's the core design. It's meant to be incredibly gentle. Patients usually report minimal discomfort, often just describing it as a pleasant, warm sensation in the throat.
Really, just warmth.
Generally, yes. It's genuinely a walk-in, walk-out procedure. There's absolutely no downtime needed afterwards.
Wow.
And a huge point, especially compared to CPAP, which boosts comfort and compliance massively.
Yeah.
No devices to wear during sleep, no chemicals involved. It just removes those nightly compliance issues entirely.
Okay, so the main goal for NightLase is crystal clear. Reduce the snoring noise, lessen OSA severity, and do that by fundamentally improving the structure and stability of the upper airway.
That's the objective.
So how does it actually do that? This is where it gets really interesting, the mechanism.
Right. The secret sauce is in the specialized laser tech it uses. NightLase primarily uses something called an ERAG laser.
You're right.
Yeah, erbium, yttrium aluminum garnet. Think of it as a very sophisticated light source that mostly works gently right on the surface of the tissues.
Okay.
Some of the more advanced systems, like Photonis SP Dynamis, might also incorporate a different laser type, NDYAG, for a subtle, deeper heating effect to really kickstart the body's rebuilding process.
And I read about something called patented VSP technology, variable square pulse. What's special about that?
Ah, VSP, yes, that's really clever.
Yeah.
Think of Photona's VSP tech like a smart dimmer switch for that laser light. Instead of just a constant blunt beam, it delivers these tiny, precisely shaped pulses of energy. This makes sure the laser energy goes exactly where needed into the target oral tissues.
Which tissues specifically?
We're talking soft palate, uvula, the base of the tongue, maybe the tonsils, and the surrounding throat areas, the pharyngeal walls.
Okay.
And crucially, it does this without overheating or affecting the surrounding areas unnecessarily. It's all about precision for maximum effect and, importantly, patient comfort.
So it's targeting those key floppy bits like the soft palate and uvula. But what happens biologically when that laser energy actually hits the tissue? This is where the real magic starts, right?
Absolutely. This is what we call the multimodal biological response, and it's pretty remarkable. First, there's an immediate effect.
Okay.
The gentle heating causes the collagen fibers, which are abundant in these tissues, to contract almost instantly. You might even see a visible slight shrinkage of the treated areas right away.
So that's the immediate tightening. But you need more than just a temporary shrink for lasting results, don't you?
You're exactly right. That initial contraction is just the start. The laser also stimulates a profound long-term biological restructuring.
Restructuring how?
Well, it promotes the reorganization and strengthening of your existing collagen matrix, the scaffolding, if you like.
Right.
And critically, it triggers something called neocollagenesis.
Neocollagenesis, new collagen.
Exactly, the stimulation of new, stronger, and more elastic collagen fibers. And this incredible rebuilding process, it continues for months after the treatment sessions are finished.
Months? Wow.
Yeah, which is why the results tend to be progressive and sustained over time.
So it's not just like tightening old saggy tissue. It's actually prompting your body to build new, better, more resilient tissue from the inside out.
Yeah.
That feels like a fundamental shift.
It really is. And molecular studies back this up. They show the laser exposure actually increases gene expression related to tissue remodeling, angiogenesis, which is new blood vessel formation, and general healing processes. It's literally signaling your cells to rebuild and rejuvenate the tissue structure.
Amazing.
And it might be even more complex. Beyond just the collagen, there's some evidence suggesting other subtle effects, maybe on the neuromuscular function in the throat, or even photobiomodulation, the light itself having a direct healing effect on cells. It seems to be a truly multi-layered biological response.
Okay, so if I'm getting this mechanism right, it's this synergy, this combination effect. Immediate tightening from collagen contraction. PLUS, this ongoing production of new, stronger, more elastic collagen over months.
Correct.
How does that translate into actually helping the person stop snoring or breathing better if they have OSA?
Well, that combined effect significantly tightens and strengthens those throat tissues that were previously maybe a bit flaccid or prone to collapsing during sleep.
Right.
It increases their resistance to collapse. By tightening the soft palate, the uvula, the pharyngeal tissues, NightLase effectively creates a wider and more stable airway.
Or wider and more stable. Okay.
Yeah. This physically prevents the tissues from, flapping around and obstructing airflow. That directly reduces the noisy vibrations of snoring.
Got it.
And dramatically improves airflow for people with OSA.
Yeah.
It's essentially restoring a more optimal open architecture to your airway while you sleep.
So just to recap the mechanism, NightLase supplies precise laser energy using things like ERYE and VSP tech. This immediately causes some tissue contraction. But crucially, it kicks off this long-term biological restructuring, making new collagen, regenerating cells, strengthening everything.
That's the core of it.
Which leads to firmer tissues, a wider airway, less vibration, less collapse, ultimately better breathing and better sleep quality.
Exactly. Now let's talk about the results people actually see. The clinical efficacy and the patient benefits reported for NightLase are quite compelling.
Okay, let's hear them. Snoring reduction first.
Significant snoring reduction. Reports generally show decreases ranging from 40% up to an incredible 90%.
90%. Wow.
Yeah. And over 80% of patients in studies report some reduction, with quite a few experiencing nearly 100% improvement, like silence.
That would be life-changing for so many couples.
Okay.
Okay, what about for OSA? How do you measure improvement there?
For OSA, the key metric is the Apnea Index, the AHI. It tracks how many times your breathing stops or gets very shallow per hour of sleep.
Right.
Studies indicate that around 78% of NightLase patients saw their AHI score reduced by 50% or more.
Half or better for most people.
Yes. And the average improvement across patients was around 66.3%. That's a very significant clinical improvement that translates directly to better health outcomes.
And I remember seeing the patient satisfaction rates were really high too.
Remarkably high, yes. Consistently ranging from 65% up to an impressive 96% in various studies. That really speaks volumes about the patient experience, doesn't it?
It really does. How long do these results typically last? Is it permanent?
It's not usually permanent with just the initial course. Results generally last somewhere between 6 to 14 months, with the average being around 12 months, so about a year.
Okay.
To maintain those optimal results, an annual or sometimes biennial, every other year, touch-up treatment is recommended.
Like maintenance.
Exactly. And importantly, there are no known long-term side effects from doing these continued or repeated touch-up sessions.
That's crucial. But you mentioned it goes beyond just better sleep. There were these broader quality of life improvements. What kind of things?
Yeah, beyond just quieter nights and feeling more rested, patients consistently report significantly less daytime fatigue, fewer mood swings,
Big ones.
huge ones. Many find their interpersonal relationships improve because, let's face it, chronic snoring and fatigue can strain relationships.
Definitely.
It also often brings relief from those other awful side effects of poor sleep, the chronic morning headaches, maybe feelings of depression, that persistent draining exhaustion.
Okay, that all makes sense. But then I saw something truly surprising in the source material. It mentioned aesthetic benefits, too. That seems almost too good to be true.
It does sound surprising, doesn't it? But this is a fascinating, perhaps even revolutionary point about NightLase. The very same process that tightens your throat tissues.
Yeah.
The collagen stimulation.
Well, it also has a noticeable effect on the skin, particularly around the mouth and lower face, potentially treated during the procedure.
How so?
It stimulates collagen production externally, too, which can actually reduce the appearance of wrinkles.
Get out, so you wake up more rested and looking more refreshed. Kind of like a non-surgical facelift effect built right into your sleep treatment. It's genuinely a multifunctional approach. It addresses sleep quality and skin health. It really challenges our traditional view of what a medical treatment can achieve.
Wow. Okay, so let's summarize these benefits again. We've got major snoring reduction, 40–90%. Significant OSA improvement, like a 66% average AHI reduction. Incredibly high patient satisfaction, 65–96%. Results lasting about a year, easily maintained with touch-ups.
Right.
Plus, all those quality of life boosts: less fatigue, better mood, better relationships, fewer headaches, and this unexpected, powerful aesthetic bonus.
That's a pretty compelling package.
Absolutely. So given all that, the next question for anyone listening has to be, okay, how do I actually do this? What does the treatment process look like?
Good question. The standard approach, the typical protocol, usually involves 3 separate treatment sessions.
3 sessions.
Yeah, spaced several weeks apart, usually about 3 weeks between each session.
So over about 6 to 9 weeks total.
Roughly, yes. Though it's adaptable. For more complex cases, the protocol might be tailored slightly, maybe 3 to 4 sessions spread over 9 to 12 weeks, or sometimes even 4 to 6 sessions if needed. It really highlights that personalized approach. Not everyone's airway is the same.
Makes sense. What happens before you even start the treatments?
The process nearly always starts with a thorough initial consultation. This is absolutely crucial.
Why crucial?
Well, the clinician needs to assess your specific airway issues, look at your medical history, and really determine if NightLase is the right fit for you. This might involve looking inside your mouth and throat, maybe even objective measures like a home sleep study, or using an app like SnoreLab to get a baseline of your snoring.
Okay, so proper assessment first. Then the treatment itself. You mentioned steps, like a conditioning phase.
Yes. The first part of each session is often called conditioning. The laser light is used very gently to sort of heat and prepare the targeted tissues in your mouth and throat.
Like a warm-up.
Exactly. Then, following that conditioning, comes the tissue strengthening step. Here, A slightly more powerful, but still completely safe, setting of the laser penetrates a bit deeper.
And this is where the collagen magic happens.
This is where it actively stimulates that new collagen production and those regeneration processes we talked about to strengthen and support the tissues over the long haul. It's meticulously applied to areas like the soft palate, the uvula, the base of the tongue, and maybe the tonsils if they're contributing.
Okay, so what's it actually feel like for the patient sitting in the chair during these sessions? Is it uncomfortable? How long does it take?
It's designed to be remarkably convenient and comfortable. The sessions are usually done right there in the clinic, often in just a standard dental chair.
No hospital needed.
No hospital. And each session is pretty quick, typically lasting somewhere between 20 to maybe 60 minutes.
And pain, anesthesia.
Almost entirely pain-free. No general or even local anesthesia is needed. Patients usually just report feeling that mild, warm sensation in the back of their throat.
Okay, and afterwards, can you just go back to work?
Absolutely. The best part for many people is zero downtime. You can immediately return to all your normal daily activities, eating, drinking, talking, working, whatever.
Seriously, immediately.
Immediately. Some people might notice a slight throat irritation or a bit of dryness afterwards, kind of like a mild sore throat, but that's usually very temporary and resolves quickly.
So it's not like surgery recovery at all. But you also said the results are progressive. It's not an instant fix after one session, even though the session is quick.
Exactly right. While you might notice some improvement even after the very first session, maybe snoring is a bit quieter, the optimal and most lasting results develop gradually.
Why gradually?
Because that crucial neocollagenesis, the new collagen building, takes time. It continues for several months after the course of treatments is finished, and the subsequent sessions reinforce that process. It's a cumulative effect, building a stronger, more stable airway from within over time.
Okay, got it. So treatment process in a nutshell. Typically 3 sessions, about 3 weeks apart. Each one is quick, 20, 60 minutes, no anesthesia, no downtime. You can eat and talk right away, feels warm during, maybe slight irritation after. And the best results build up over the months following the full course.
You've got it, which leads us naturally to safety.
Right, a big consideration for any medical procedure. How safe is NightLase?
It's widely considered to have a very high safety profile. This is backed up by numerous clinical observations and published studies. It's a very important point for anyone considering a new treatment like this.
That's definitely reassuring. What about side effects? Are there any serious concerns listeners should know about?
Well, as I mentioned, the side effects consistently reported are generally mild and temporary. Things like that slight throat irritation or dryness.
Okay.
And critically, this is worth repeating, there are no known long-term side effects associated with continuous or repeated use for maintenance.
That's huge compared to surgery.
It really is. It stands in stark contrast to potential permanent complications from some surgical options. And a key safety feature underpinning this is that the Air YAG laser operates in what's called a non-ablative mode.
Non-ablative, meaning?
Meaning it gently heats the tissues to stimulate that collagen response without actually vaporizing or damaging the surface layer. It doesn't cut or burn the surface. This is vital when you're working with the delicate tissues inside the mouth and throat.
Okay, non-ablative heating, not cutting. But even with that strong safety record, are there still important things to consider? Like, does it work equally well for absolutely everyone with snoring or apnea? Is patient selection important?
That's a very astute question. You're right, it's not a magic bullet for every single case. NightLase is generally found to be most effective for, let's say, selected patients with mild to moderate snoring or OSA.
What determines selection?
Various factors come into play. Things like your BMI, the specific anatomy of your throat, your baseline AHI score if you have OSA. Even lifestyle factors like smoking status can influence suitability and outcomes.
So it's not necessarily the first choice for very severe OSA, perhaps.
Potentially not as a standalone treatment for very severe cases, though it might be used adjunctively. Also, it's not a one-size-fits-all treatment protocol. As we touched on, the approach might need to be tailored for specific airway issues, and more complex cases might need more sessions than the standard 3.
Right, that personalized aspect again. And since it's relatively newer technology, does the skill of the person doing the procedure matter a lot?
Absolutely. That's a very important factor. The source materials do note that as a relatively new technology, practitioners are still refining the optimal techniques and learning the nuances. This really underscores how important the clinician's expertise is, their understanding of airway anatomy, laser physics, and their ability to create a personalized treatment plan. That's key for getting the best, most sustained results.
And it also points to the need for ongoing research, right, to keep refining things.
Exactly. It highlights the continued need for robust clinical research to further refine patient selection criteria and maybe standardize those treatment protocols even more across the board.
Which brings us perfectly to the scientific evidence itself.
Mhm.
What does the actual research data say about NightLace's effectiveness and safety? Is it well supported?
Yes, overall, there are numerous scientific studies and reviews that consistently support both the efficacy and the safety of using this type of ERIAG laser treatment for snoring and OSA.
Can you give an example?
Sure, there was one study involving 30 patients that showed significant snoring reduction and really high patient satisfaction, over 96%.
Wow.
Another study from Poland reported statistically significant improvements in subjective sleep quality, how people felt they slept, and also objective reduction in hypopnea counts, those shallow breathing events.
Okay.
There was also a 2-year study looking at 76 patients, which found significant improvement in almost 70% of them after just 6 weeks of treatment.
And what about broader reviews that look at multiple studies?
Yes, a comprehensive review analyzed data from 12 different studies. Its conclusion was that EROYAG laser therapy is safe, it's well tolerated by patients, and importantly for accessibility, it can often be performed comfortably right in a dental chair.
Making it much easier to access than hospital procedures.
Definitely. And for OSA specifically, those AHI reduction figures we mentioned earlier are solid evidence that 50% or greater reduction in 78% of patients and the average 66.3% improvement. That's clinically meaningful data.
And it's not just about observing patients, right? You mentioned they understand the mechanism at a molecular level, too.
That's right. There's in vitro research studies done in the lab on tissue samples showing that this type of non-ablative laser exposure actually increases the expression of genes related to tissue remodeling, angiogenesis, new blood vessel growth, and general healing.
So they can literally see the build and repair signals being turned on.
Exactly. It provides a strong molecular foundation that helps explain why it works clinically. It's not just magic, there's biology behind it.
Okay, so the evidence for the immediate effects, the safety, the mechanism that seems pretty strong, based on moderate quality evidence, as the sources say. What about long-term outcomes, like years down the line?
That's a really crucial distinction for listeners to grasp. While the evidence for the immediate effects and safety is quite good, moderate quality, the evidence specifically for long-term outcomes, say beyond a year or two, is currently rated as lower quality.
Why is that? Just newer tech.
Mainly because the technology is newer, so those really long, multi-year follow-up studies with large patient groups are still ongoing or haven't been published yet in large numbers. Researchers consistently call for these larger, longer-term studies to really solidify the evidence base for sustained efficacy over many years and help fully integrate NightLase into standard clinical practice guidelines.
So for someone considering it now, what does that mean practically?
It means it's a proven, safe, and effective solution for the short to medium term, with an excellent track record over that period. The medical community is confident in that. But we're still building the really robust, decade-long data sets.
Okay, that makes sense. So as we wrap up this deep dive then, how should we summarize the overall impact and the future outlook for NightLase? It feels like more than just, another option on the menu.
I think that's fair to say. NightLase really does represent a groundbreaking, non-invasive, and remarkably patient-friendly solution. It effectively reduces snoring and improves mild to moderate OSA.
Yeah.
Its sophisticated mechanism, that precise laser-induced collagen response, the long-term tissue restructuring it creates that wider, more stable airway. And critically, it tackles the root cause without the daily burden of devices or the risks of surgery.
It feels like a fundamental reimagining, doesn't it?
Yeah.
Moving from lifelong nightly rituals or invasive surgery to a series of gentle, quick, painless sessions that improve your health from the inside out.
Mm-hmm.
And maybe even make you look a bit better, too. That's the insightful aha moment NightLase offers, I think.
It absolutely is. NightLase stands as a really significant advancement in sleep medicine. It offers this convenient, easy-to-use, and effective alternative. And its unique ability to continuously improve breathing without needing nightly device use is huge for patient compliance and, as we discussed, overall quality of life.
Yeah.
This whole package of advantages makes NightLase feel like more than just an incremental step. It potentially signifies a real paradigm shift in how we manage sleep-related breathing disorders.
A paradigm shift towards what?
towards more comfortable, effective solutions that address the underlying tissue problems without the daily compliance hassles or surgical risks. It really reflects that broader trend in medicine towards less invasive, more patient-centric advancements.
And looking ahead, you mentioned the need for more research. That's still key, right?
Absolutely. While the current data is strong and very promising, that ongoing need for rigorous research with larger patient groups and longer follow-up is vital. It will help solidify its long-term benefits, optimize protocols further, and integrate it even more broadly into clinical guidelines.
And maybe uncover more about those other subtle effects.
Precisely. Further exploring those broader biological effects like potential neuromuscular changes or the photobiomodulation aspect could reveal even deeper insights and maybe even expand its applications down the road.
Okay, so NightLase offers this truly unique combination. Non-invasive, effective for snoring, and mild to moderate OSA, going beyond just medical treatment into overall well-being and even, remarkably, aesthetics. All thanks to some intricate science we've unpacked.
It's a really fascinating example, isn't it? How technology is enabling these less invasive, more patient-focused advancements that really resonate with improving daily life, not just treating a condition.
Which leads to a final thought for you, our listener. Considering how NightLase blends medical treatment with aesthetic enhancement, what other areas of healthcare do you think might be ripe for similar, multifunctional, non-invasive innovations? Innovations that could seamlessly improve both our health and our daily lives. Something to think about.